I was involved in healthcare and in trauma when level trauma started. So when I first started, just the closest hospital would get the patient. So if you were whatever you were, mechanism of injury, you would go to that hospital. And then in the 80s, they did studies in California where they had designated trauma centers, and they would get people to the designated trauma centers within the hour. And so I had the opportunity of working at a hospital where we started out as level 3, and then we went up to level 2, and then we were designated with level 1. So I learned about process, and it was an evolution of that at that time of trauma care and the golden hour and different things there. So it was really exciting, and it was a lot of fun. Very similar to what is happening in simulation now as we evolve from, high fidelity mannequins to virtual reality to augmented reality. So after I did that in emergency department, I did some work in assisted living nursing home, and I found a special passion for that, because when patients went to the emergency department, they always thought that everything was going to be okay, that we'd be able to fix them. But unfortunately, sometimes we couldn't. And when I worked in the nursing home, I had the opportunity to help families learn about end of life and dealing with end of life issues and helping them usher their family and loved ones to the end. And so it was a really good learning curve for me. And then I got into education, where I found kind of a new chapter, and I found out about simulation.